Hi, today we're going to talk about acid reflux symptoms to help you identify whether or not you may have acid reflux, and if so, what you could do about it. You can also claim instant free access to your Beat Your Heartburn report by going to www.beatyourheartburn.com. So what are the typical symptoms of acid reflux? The most obvious one is the burning feeling in the middle of your chest, usually around about where your heart is, and therefore why it's often called heartburn. It is in fact stomach acid refluxing into the base of the throat and causing the burning sensation. There are three possible times at which this can occur. The first is after meals, also usually at night when going to bed and lying on your back, and last of all, when lifting heavy things. There are other, less obvious symptoms of acid reflux. The first is intestinal gas, and often referred to as burping. Also, nausea and vomiting. Difficulty in swallowing food. And finally, excessive coughing. Now, it must be stressed that even if you have one or several of these symptoms, this does not necessarily mean that you have acid reflux. So, the first thing you should do, if you suspect you have acid reflux, or have any problems whatsoever, you should see your doctor. And the first thing you should discuss with your doctor is that often acid reflux symptoms can be confused with heart conditions. So the first thing to do with your doctor is to check for heart disease first. If your doctor is happy that there is no issue with heart disease, then you can discuss the possibility that these symptoms are indeed acid reflux. Now, your doctor is most likely to try and prescribe you some medication for acid reflux. Now, this is not necessarily a bad thing because acid reflux does cause some very severe damage if allowed to continue for a very long time. So, please discuss with your doctor all available medications. Now, it must be stressed that medications are usually only recommended for a period of approximately 6 to 8 weeks. So you should actually read the label of your antacid pills. If you're having to use them for more than the prescribed period of 6 weeks to 8 weeks, then you should look into more serious methods of dealing with this. Also, your antacids do have side effects, which many doctors will not actually discuss with you. So you should always read the label and make sure that you know what you're taking. And finally, I highly recommend that you visit www.beatyourheartburn.com for your free report. See you there.